Good day to you, good and gentle people. This is In Sickness and in Health, Week 7 Storytelling. DNA, RNA, T cells, B helper cells, cell replications, all words that we have learned in anatomy and physiology. But in 1980, they were words that the world was learning the hard way with the new and very scary AIDS epidemic. Human immunodeficiency virus, HIV, came with a lot of baggage, rapid progression, deadly to the tune of 100% in the beginning, sexually transmitted disease, running rampant in the gay communities, and fear born at the sight of any blood. In recent history, HIV challenged every aspect of medicine, science, ethics, euthanasia, communication, and the mass media. Indigent hobos, hookers, businessmen and women, mothers, fathers, famous movie stars, and even some basketball players were dying. As with all the viruses you will be reading about over the next 3 weeks, illness and death was and is indiscriminate. HIV was and is an equal opportunity killer. As the scope of this dangerous new virulent virus among us was known, the public clamored for protection. Sorry, no vaccination for this one, still years away, if ever. We called for isolation. No HIV child was able to go to school for months. No HIV teen was able to participate in sports. No HIV positive man or woman was able to get health insurance or even get a job in some cases. There were calls, and these were serious at the top level political calls, to isolate all HIV positive people, especially the gay community, on an island like the leper colonies of history. Gloves, masks, personal protective gear flew off the shelves, and the pharmaceutical companies made a killing in the chase for a cure. I was a young PA at the time and remember several stories that illustrate our panic and our paranoia. It was a time that would have disappointed Hippocrates. My first story. Gina was a 12-year-old child of an drug addict mom and an absent dad. She sold herself in men's bathrooms at concerts for 25 cents for drug money. I met her on the drug rehab ward in 1981. She had 5 sexually transmitted diseases and had early cervical cancer for all those infections, but she was not HIV positive. Gina's absent dad did have insurance, which was the only reason she was getting help on the locked ward, until the insurance company got her first billing set. They canceled the insurance because we had done an HIV test. Remember the chapter about how we depend on tests? It made no difference that she was HIV negative on that test. Her behavior put her at risk. This is a true statement. However, she was HIV negative. But because her behavior put her at risk, the insurance company was protecting their bottom line. Canceled. Gina was canceled. Second story. Tom was a 26-year-old engineer, gay and dying of AIDS. I met him in 1980. He was one of my first patients. He had had pneumocystis pneumoniae, a pneumonia common only to immune-deficient patients. We had had the antibiotic called pentamidine that would fix this part of his disease and other diseases since 1960. It would help him breathe, and he would be more comfortable as he died. In the space of a month, the medication that cost $29 a bottle zoomed to $250 a dose. Eventually, it would reach $500 a dose. Why? The pharmaceuticals said that they had not officially tested it with HIV and AIDS patients, and they needed the resources to properly test it. Really? Story 3. Jeanette was a mother of 5 small children, ages 9 to 2, living in a burned-out house on the edge of town. She was a hooker, and she had been a hooker all her life. She was 36 and dying of AIDS. Her home had 5 mattresses, 2 chairs, a table, and a cook stove. The kids brought water up from an old faucet 2 burned houses down. I was amazed at Jeanette's positive attitude and her efforts to ensure that her kids would find something better after her death. As I walked out of the hovel, the medical professional with me said, "She deserves this for sinning all her life. The nation is suffering for its sins." Hippocrates would have cried. Jeanette died 2 weeks later in a clean bed in hospice. Her children were adopted. Story 4. My last story is of a family, a mom, a dad, and 2 children. 3 were HIV positive in 1982. Dad was a hemophiliac and had received tainted HIV blood. He had passed the virus to his wife, and she had passed it to their first child. Yes, to the first child. No, to the second child. Had to think about that first. He was dying. She was sick. And the 2-year-old was asymptomatic but HIV positive. He had lost his job due to his HIV status. She was too ill to work, and nobody would take the 2-year-old that was not allowed into daycare. When he died, there were no tears, only the realization that she was next. Mom died 6 months later, and the child died of an allergic reaction to a common antibiotic used to fight yet another pneumonia. A virus, a positive or negative test, a society scared and accusatory, medicine unable to meet the challenges. HIV has it all. Today, HIV is still killing hundreds of thousands of people worldwide. It has mutated. Most viruses will. They tend to become less virulent because a dead host cannot help propagate the virus. We have medications to stave off AIDS, but they cost lots of money. They have many side effects, and there is still no vaccination. Hippocrates would have been disappointed in our reactions.